Hi, I'm Mike from here at GBMC Physical Therapy Department, and your surgeons just want me to show you a couple exercises you can do for your total hip replacement. Very easy, very basic. What we're going to do first is basically we're going to do a glute squeeze. We're going to squeeze our butt cheeks together like you're trying to go to the bathroom or picking up $1,000 bill with your butt cheeks. Then we're going to show you how to do some quad sets, and then after that, short arc quads and some long arc quads that you'll be able to do not only here in the hospital room, but you'll be able to do when you get home. So the first one's very easy. All we're going to do is squeeze our butt cheeks nice and tight. Again, like you're trying to go to the bathroom or picking up $1,000 bill. You're going to squeeze them, hold it for a count of 5. 1, 2, 3, 4, 5, and then relax. The reason you want to hold it is because by holding it, it's an isometric exercise, and that's where we're going to gain some strength. So you just squeeze them nice and tight. Unfortunately, you got to take your word for it that you're doing it, but you're going to hold it 1, 2, 3, 4, 5, then relax. If you want, progress and then squeeze, hold it for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then relax. The next best one to do is what's called a quad set, and all you're going to do is push your knees straight down, trying to get your legs as straight as possible. That you're going to hold again for a count of 5. 1, 2, 3, 4, 5, and then relax. Squeeze, push those knees straight down and hold it. 1, 2, 3, 4, 5, and then relax. And again, progress that one, so you squeeze, pushing down, hold, and then hold it for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. The isometric part of the exercise is really key by holding it, because that's where we're going to build some strength. When you guys get really coordinated and can multitask, then we're going to combine the two, and we're going to squeeze our butt cheeks. At the same time, we're going to push those knees straight down. So you ready? So what we're going to do is squeeze those butt cheeks nice and tight, push those knees down, hold it for a count of 5. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5, and then relax. And again, the reason why we're doing this, and you can do them anywhere. Remember, you can do them in the car, you can do them while you're watching TV, but these are the muscles, again, that we're using to stand up and sit down and to be able to walk forward. The next one's very easy, very basic as well. It's called a short arc quad, very popular. And what we're going to do is we're going to take a blanket that you can use in your hospital room when you get home, put it underneath your knees or the bottom part of your thigh. If you don't have a blanket, you can always, what we do is usually use a pillow, and you can double up a pillow and use a pillow to put underneath your knees. Or when you get home, you can use a coffee can, you can use a full 2-liter bottle of Coke or Pepsi if you prefer. And basically what we're going to do is we're going to keep the back of your legs against whatever you have it against, and then you're going to kick up, hold it there for a count of 5 or 10, and then slowly bring it down. You're going to kick it up, hold it for a count of 5 or 10, and then slowly bring it down. The reason why you want to hold it, again, because it's an isometric exercise, and that's where we're going to gain some strength. You're going to bring it down nice and slow because it's an eccentric contraction. Believe it or not, you actually gain more muscle strength bringing it down slow than you do by bringing it up. That's why you see the guys and girls at the gym slowly bring those curl bars down, because they're gaining more strength that way. So you're going to kick up, hold for a count of 5, 10, and then slowly bring it down. The reason we're doing these exercises is because when we walk, right, we land on our heel, we push off on a toe, and it helps to bring our foot forward. So the next one's called a long arc quad. So we just did the short arc quad. Basically, you're going to sit in a chair where you feel comfortable. You keep the back of your thighs against whatever you're sitting on. You're going to kick up, then hold it for a count of 5, 10 seconds, and then slowly bring it all the way down. And make sure you get it all the way back to the chair. Don't just stop here, because that's where your foot hits the ground, but bring it all the way back to the chair. So you're going to kick up, hold for a count of 5 or 10, and then slowly bring it down. Now I know you're probably tired of me saying this already, but you're going to kick up, you hold it for 5 or 10 seconds because it's an isometric exercise. We're gaining some strength that way. You bring it down nice and slow. It turns into an eccentric contraction. You actually build more muscle strength, bring it down nice and slow than you do by kicking it up real fast. So you're going to kick up, hold for a count of 5 or 10, and then slowly bring it down, come all the way down to the chair. Now when you do these, try to do them throughout the day, 2 or 3 times a day if you can, 20 or 30 times. The last thing we're going to do basically is ankle pumps and then seated heel to toes. Those are basically ankle pumps with your feet on the floor, where you're going to bring them all the way back, try to touch your toes to your nose, and then push all the way forward, all the way back, all the way forward. The reason why it's so important, because after your surgery with a total joint replacement, very high incidence of getting blood clots. That's why your surgeons do everything they do, and that's why you're getting some sort of blood thinning medication for a period of time. But the one thing you can do on your own are these ankle pumps. bring your toes to your nose and then push all the way forward like you're stepping on a gas pedal. Bring your toes all the way back as far as you can. Keep those legs nice and straight and then push all the way forward. That gets the circulation going and that really helps prevent blood clots, because unfortunately the less mobile we are, the more likely we are to get blood clots. And you guys aren't super mobile now, you weren't super mobile coming in. So it's really important, just try to do this throughout the day for the next couple weeks. Now we're not holding the stretch, because actually the benefit of doing the ankle pump is getting that pumping action. So all the way back, all the way forward, all the way back, all the way forward. The other variation what you want to do when you're sitting in a chair, just sit up, keep your feet flat on the floor, and basically you're doing ankle pumps with your feet on the floor, where you're going up on your toes like you're a ballerina, and then bring your toes all the way up to the ceiling. So you're going up on your toes, and then bring your toes up in the air. Try to do this as often as you can. Now from now on, long car drives and airplane flights, make sure you guys are doing this. And you actually want family and friends to do it as well, because plenty of people got blood clots on long car drives and airplane flights and never had joint replacements. So you just contract and relax those muscles. When we walk, we land on our heel, we push off on our toes, so working the muscles we do that with. But again, by doing it, we contract and relax those muscles, working as a pump, keeping that circulation going. So that concludes our exercises for the total hip replacements. I hope you enjoyed them. Try to do them throughout the day if you can, while you're here in the hospital and when you get home. I would do them 2 or 3 times a day, about 20, 30 times, whatever you feel comfortable. Again, make it easy on yourself. Do it when you're watching TV, when you're reading a book. So if anybody has any questions, please feel free to contact your surgeon. And from everybody here at GBMC, we wish you the best in your rehab. Keep smiling, keep doing your butt squeezes.